I'm Dr. Sendi with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. And I'm going to review ketamine therapy for depression and some of the basics about ketamine therapy. So, what is ketamine? Ketamine was created in 1962 by Calvin Stevens. It was FDA approved for anesthetic purposes in 1970, and it was placed on the essential medications list for the World Health Organization in 1985 because ketamine is such a useful medication in the anesthetic arena and such a safe medication that the World Health Organization felt it was an essential medication for every country in the world to have for the purposes of anesthesia. It's extremely safe in high doses. It maintains cardiovascular stability and respiratory status, and it effectively is a dissociative anesthetic, meaning that it separates pain from any type of sensation or memory. So, in other words, the person will effectively not be able to recall any events that occurred during a procedure. Now, ketamine does exist in a racemic mixture. It has a right-handed form and a left-handed form, and the two occur together in IV ketamine at 50-50 percentage. However, there is S-ketamine, which is FDA approved as a nasal spray, and that was in 2019, and it's used for treatment-resistant depression in the office setting. And that one has been around since 2019. It is effectively the same thing as ketamine, except for the left-handed form and the right-handed form have been separated out from each other. And then we're just using the S form only for treatment of depression. Now, like all substances, there is some abuse potential with ketamine, but for individuals who use ketamine and abuse it on any regular basis, there's no true withdrawal syndrome. Generally speaking, ketamine is abused in rave settings and in certain populations, usually mixed with other drugs. And ketamine, however, has been found to be extremely safe at high doses in terms of its ability to maintain respiratory status and cardiovascular stability. So this is ketamine in its right and left-handed forms, and you can see that basically they are mirror images. And each side is effectively useful in the treatment of depression. They offer different advantages from various studies that have been out there. The IV formulation is a 50% mixture of both the right-handed and left-handed forms of ketamine. So what conditions does ketamine treat? Well, treatment-resistant depression is top on the list, but ketamine can also be used to treat initial forms of depression, to augment medication response. Ketamine is also effective in post-traumatic stress disorder, certain anxiety disorders, obsessive-compulsive disorders, bipolar depression, postpartum depression, and certain pain conditions like cluster headaches, trigeminal neuralgia, and chronic regional pain syndrome, CRPS, or otherwise known as reflex sympathetic dystrophy. And there are many other uses for ketamine as well. These are just some of the basics. We're primarily focusing on treatment-resistant depression and depression with this talk. Now, contraindications to ketamine therapy, or at least conditions requiring medical evaluation, would include uh, cardiovascular disorders such as recent heart attack, stroke, or peripheral vascular disease. Likewise, if you have a history of kidney failure, or if you have a history of heart failure or liver failure, certainly those would need a prior medical clearance for a ketamine infusion for depression. Certainly, blood pressure should be controlled, as well as diabetes and lung disease as well. There should be some sort of clearance if the person has significant lung disease. And likewise, certain personality disorders and schizophrenia would also be potential contraindications or problematic with the treatment of ketamine. Ketamine does not change personality disorders. It doesn't make them worse. It just doesn't help. And the last thing is pregnancy. You should not be pregnant during ketamine infusions. So the process of ketamine infusions are actually quite in depth and complex, but you do need to understand that ketamine can do only certain things and it cannot do other things. It is a treatment, not a cure. And you have to recognize that you may need follow up infusions and maintenance therapies and adjustment of even your traditional medications. So, again, ketamine is just part of the entire treatment process, but it can augment that treatment process in a way that nothing else can, causing significant response or even remission in up to 70% of patients who have failed so many other types of medications, interventions, ECT, TMS, and other types of modalities. And we also have to recognize that certain lifestyle changes need to be made, including drug and alcohol use, and that also some individuals may do very well with augmenting the ketamine infusion process with home ketamine microdosing. If you live in a toxic environment, ketamine will not change that. It basically does not change the people around you. It won't change your personality. It won't change your kids. It won't make you like your boss any more than you like them already, or even your job. It won't make you like that either. So if you have continued trauma in your life, this will certainly impact outcomes. And likewise, ketamine cannot change the past, although it can change the way that you process information from the past. And that's important in trauma treatment. Ketamine is not a standalone treatment. It's like a weight loss program. You need to alter a number of parameters in your life. And you need to alter certain aspects of your lifestyle. For example, exercise and diet and intermittent fasting and structured time, meaning that you need to fill your day up with activities and things that encourage you to learn more about your environment, kind of a environment that is a lot more enriched so that you feel more challenged. Likewise, substance use needs to be addressed as well. If there's alcohol or opiate use disorder, those need to be addressed in order for ketamine therapies to be successful. And finally, increased socialization. It's always helpful to be able to socialize with other individuals under a number of different scenarios. And so all these different aspects of lifestyle certainly add to the bottom line of enhanced depression improvement. Now, medications basically do not need to be altered prior to your ketamine therapy. So we tell people pretty much just to stay on their current medication regimens, and their psychiatrists and psychologists can adjust those as needed. But there are possibilities that certain medications can make ketamine therapies a little less effective, such as benzodiazepines and even Lamictal. But the studies on those are, again, not entirely clear. Generally speaking, we find that just higher doses of ketamine therapy may be needed in individuals who take benzodiazepines. And ketamine does seem to work in anxious depression as well. So we know that ketamine is FDA approved for anesthetic purposes, but its use in IV infusions for depression and other types of issues is off-label, meaning that it's being used in a different manner than the FDA approval process intended. This doesn't make ketamine unsafe or ineffective. It just means that the ketamine, when it's used in an IV drip form for depression, is basically just being used in a manner that was outside of what the FDA originally approved it for, and that it did not go through the FDA approval process for this indication. But we do know that that ketamine at higher doses is extremely safe in anesthetic purposes, and that for IV purposes for depression, we're using a significantly lower dose, some 1/10 or even smaller than an anesthetic dose. And likewise, we do know that Spravato, which is FDA approved, ketamine, is also safe, and it's being used and FDA approved. So off-label use is extremely common for a number of medications, such as the use of aspirin for heart attacks. It is not FDA approved for that use, but yet we know that it works based on numerous studies. It's just that it takes a lot of cost to pharmaceutical companies to actually basically create new indications and FDA approve that for certain types of medications. And ketamine, unfortunately, is not something that can be patented because it's been around for so long. Now, I mentioned earlier about Spravato being FDA approved for a nasal spray for in-office use for treatment-resistant depression. Now, Spravato does require twice weekly visits to the doctor's office for the first month and then weekly thereafter. And this one is ketamine, but it is only the S version of ketamine that's being used. And we also mentioned about ketamine being extremely safe. And with over 50 years of use of ketamine, there are very few deaths associated with ketamine in and of itself. Whereas if you look at a medication like Tylenol, it kills approximately 150 people or more per year. And ketamine has been used in extremely high doses and it's very safe. But most of the time when there's a problem, it's in the context of abuse or when it's mixed with other drug use or significant medical problems. In the arena of depression treatment, we are using low doses of ketamine, significantly lower than anesthetic doses. Now, as far as the abuse of ketamine, just like anything else, like sugar, coffee, and food, or scheduled medications like opiates and pain pills, they all can be abused or misused. But the physical withdrawal syndrome is not present with the use of ketamine or psychedelics. So basically, and of course the reading here says there is physical withdrawal, but there is not physical withdrawal syndromes associated with the use of ketamine or psychedelics. And the trippy effect actually diminishes over time. So if you want to consider ketamine therapy for depression or treatment-resistant depression, you can actually start it at any time. You don't have to necessarily be treatment resistant. Ketamine can potentially augment your antidepressant response and make your antidepressants work faster and more effectively. And in this particular study in 2015 by Hugh and his colleagues, they used a single IV dose of ketamine to augment Lexapro or escitalopram for major depression and found that it was effective in increasing response rates and the ability of the number of people to be treated at a higher number when ketamine was initiated early in depression. Likewise, you would want to consider ketamine therapy if you've undergone treatment with several antidepressants and have continued to have low mood, poor functionality, fatigue, brain fog, low motivation, or anhedonia, which is no mood at all. And that's basically you don't feel excited about anything, but yet you're not necessarily crying or feeling sad. And anhedonia is a common side effect of traditional medications. We call that emotional blunting. One thing you have to recognize is that in poorly treated depression, there can be a loss of gray matter in key areas of the brain that affects cognitive abilities. And I have a reference below here discussing regional brain volume losses in depression and anxiety disorders out of the JAMA in 2010 as just an example. We also know that depression affects a number of other areas of cognition, including verbal memory and nonverbal memory, and that there are toxic effects of depression on brain function, based on a study by Gorwood and his colleagues in 2008, that there was impairment of delayed recall and verbal memory, and that the use of ketamine and ketamine therapies based on a systematic review by Souza Marquez and his colleagues in 2021 did seem to demonstrate that there are certain areas that are improved and maintained better with ketamine therapies, that there are basically neuropsychiatric and neurophysiological functions of the area of the brain that may benefit from subanesthetic ketamine infusions. So ketamine infusions enhance wellness parameters based on some studies in 2016 from Sharoma and his group, in which 6 ketamine infusions actually improved key indicators that aren't addressed by your traditional antidepressants, such as calmness and energy and happiness. And likewise, there were other areas that were also impacted in a positive way, such as there was less worry, less sadness, less tiredness, and a sense of less worthlessness that was achieved through the course of ketamine infusions. So these were kind of unusual wellness parameters, but they were actually studied in a series of ketamine infusions in this particular study. So we know that there's side effects of traditional antidepressants, just like there are side effects from any medication. And these side effects are basically a number of different types, but we know that from the STAR-D trial that the majority of antidepressants do not work on their very first trial, that it could take up to 2 months to see the final effect with any type of treatment. And only 30% of patients will basically achieve any type of remission at all or response, and many of those people relapse ultimately. Now, we know that if you fail one antidepressant therapy, that the success rate of a subsequent antidepressant is less and less, to the tune that approximately 80 to 90% of a third trial of medication will not be effective in an individual. Likewise, there are side effects of traditional antidepressants, such as weight gain, sexual side effects, anhedonia, otherwise known as emotional blunting, and of course, low motivation, and there's no impact on wellness parameters by many of the traditional antidepressants. Likewise, you may be left with continued brain fog. And these are all issues because a lot of people can be made less sad and less emotional with an antidepressant, but yet they just don't feel well. They don't feel right. Now, what are the side effects of ketamine therapy? Well, the side effects are basically during the infusion only. And nausea and vomiting is one of the key ones, and this is prevented with antiemetics. Other side effects are the trippy psychedelic effects that are sometimes produce anxiety during the infusion. And this can be treated with a decreased rate of infusion or pretreatment with anti-anxiety agents if necessary. For some individuals, they find the trippy psychedelic effects to be very enhancing and very enjoyable. For others, it's not something that they find to be, very enjoyable at all. But on the other hand, though, these effects can certainly be moderated with the use of specific types of medications and the way that the ketamine infusion is done. Dizziness and vertigo can also occur during the infusion process, and basically, individuals who are getting an infusion require a driver to and from the infusion site because these symptoms can last for a few hours. So generally, people should not be driving after their infusion for at least 4 to 6 hours, if not longer. And then, of course, there's infusion-related experiences. Obviously, sometimes people will, have all sorts of bizarre thoughts and insights, which sometimes are very pleasant and sometimes very enhancing to the overall mood. And occasionally, some people, they can get, a certain sense of fear during the infusion. Again, all of these things can be moderated. The goal of ketamine, of course, is neuroplasticity and synapse formation and neural network repair from the damages of mood disorders. So, how does ketamine work? Well, that is a complicated topic that could be certainly gone over, but for the scope of this particular presentation, we'll kind of just do the basics and mention that depression and certain mood disorders are neurodegenerative, causing neuronal cell damage and loss of connectivity among neurons. We get loss of synapses and loss of supporting cell structures. And we can actually see shrinkage of gray matter in key areas of the brain involved with executive functioning, memory, and other areas of cognition, including reward. The end result is brain fog. You just can't think clearly. You can't make great decisions or have insight or impulse control. And you just don't feel rewarded from the usual day-to-day events that you are confronted with. Motivation gets low, and any sense of enjoyment goes away. And we see alterations in the functioning of neural circuitry. And of course, this is also part of the low motivation, low sense of reward that results from depression. And of course, fatigue is a big issue, as well as ruminations, negative self-talk, self-sabotaging behavior, and anxiety, all of which are more or less features of depression. And the negative side of the brain tends to work in high gear when patients are depressed, leading to more anxiety and all these negative thoughts. Whereas the positive side, the reward side of the brain, tends to be shut down. It is depressed. So, what ketamine does is it increases neuroplasticity through neuropeptide formation, such as brain derived neurotrophic factor formation, which is a key molecule. Ketamine blocks the NMDA receptors in key areas of the brain, causing a brief glutamate burst, which increases the production of brain derived neurotrophic factor. And this protein increases dendrite formation on neurons that have lost dendrites due to depression. These dendrites allow for new connections to occur. These connections are called synapses, where one neuron connects to the other neuron, and synapses are important where any type of information or learning is being done. And glutamate is a key neurotransmitter in the brain, representing over 60% of our neurotransmitter load in the cerebral cortex. And so by adjusting glutamate levels, we can basically cause the production of proteins that allow synapse repair and neural circuitry repair. And this starts within hours of treatment, way after the trippy effect is over. So in the days following ketamine infusion, we start to get this regrowth of neural pathways that have been damaged because of depression and mood disorders. So ketamine, again, does not change your personality or your behaviors. It does not change the way that you work, your job, your kids, your career. Those things are up to you. Ketamine is a treatment, not a cure. And so each of these neuroplastic things that occur with ketamine need to be maintained, just like anything else. And again, they work better and faster than your traditional antidepressants based on many studies. However, there is a maintenance that will be required to maintain this connectivity. And for some individuals, they will end up in remission and they won't need any further treatment for a significant period of time, if at all. But for others, again, just like taking your regular medications, your regular antidepressants, you may need periodic infusions to maintain this neuroplasticity, whether it's infusions or microdosing of ketamine or alterations of your underlying antidepressant. So this is an example of your neurons. And you can see on the left side, the dendrites on the far left side where information is basically received. Then we have the cell body or soma of the neuron and its nucleus. And then we can see that yellow line where the electric signals go down the axon and down to the dendrites on the other side. Now what is missing in depression and mood disorders are dendrites. Dendrites go away. Stress and medical conditions, trauma, whether the trauma is emotional, physical abuse, sexual abuse, whatever it might be, all those things cause significant stress in the brain and cause the retraction and loss of dendrites. And that's what we need to repair in mood disorders and depression. And that's what ketamine works on. So this is a diagram of a basic synapse. And we can see basically in just a short review that the presynaptic terminal at the top, which is where all the signals come from and the glutamate comes from in the higher cortical areas, is just released. And it basically interacts with the postsynaptic terminal. And through a series of complex interactions, and again, we're not going to review this entirely here, ketamine causes a blockade through a particular GABA interneuron, and it causes a quick release of glutamate that then allows the production of brain-derived neurotrophic factor in this postsynaptic terminal. And that is the terminal releasing or receiving information. And then from there, this brain-derived neurotrophic factor causes the production of certain other proteins that allow dendrite formation. Dendrites are key in basically the repair of neural networks that are damaged. So in an individual who comes into the office, we would generally do a medical and mental health consultation, looking at your mental health journey and any medical conditions that may need to be addressed. Certainly, certain labs can be of value, but not always necessary, such as general functions of liver and kidney, B12 levels, vitamin D, adrenal function, thyroid function, and several other possible labs, just depending on the person's situation. And of course, there's specialty testing, for integrative type evaluations, such as organic acid testing and food allergens, Lyme disease, mold testing, heavy metals, and stool testing even to see about stool overgrowth with things like Candida or Clostridium, which can produce toxic substances and cause damage to our neural circuitry. And of course, if anybody needs further medical workups, they would be referred, especially if they're having blood pressure issues or uncontrolled diabetes, liver or kidney failure, or cardiac risks, or lung related problems. They would need to have basically a medical evaluation for this treatment. But we are using very low ketamine doses, and there's very mild changes in blood pressure and heart rate during the infusion process, only for a limited period of time during the infusion. So we do include basically the considerations of medication alterations for the person in conjunction with their psychiatrist or psychologist, and also discuss how ketamine works, the dosing of ketamine, and the integral lifestyle modifications that make this process work even better. And of course, addressing basic things like eating disorders, exercise, and insomnia are key to basically promoting the long-term efficacy of ketamine therapies. And finally, a discussion of any trauma, that might have been occurring or still is occurring in the person's life and ways to address that, and referrals as needed. So you will need a ride to and from the infusion. It's best not to eat for the 4 hours before the infusion. You should bring comfortable clothing, noise-canceling headsets, and personal ambient music that you choose. Now, at Nova Health Recovery Ketamine Infusion Center, we do have comfortable home-like rooms with warm blankets, aromatherapy, Galaxy lamps, and Sonos sound systems, as well as state-of-the-art monitoring systems for blood pressure and heart rate, pulse ox. We do recommend that people bring friends or family that can sit with them during the infusion. It's best to declutter your mind and make the ketamine infusion experience one that is totally controllable by yourself. And then plan to take the rest of the day off after your infusion. You should take your usual medications. And also, we do pre-medicate with antiemetics. We recommend that somebody who's coming in for an infusion be as comfortable as possible. And we prophylax individuals so that they don't feel nauseated during the infusion experience. We do start small gauge IVs, generally 24 gauge IV needles, which are extremely small pediatric size needles with cold spray or topical numbing as needed. And then the infusion starts. So expect a 40 to 45 minute infusion. We generally start our first infusions at 0.5 milligrams per kilogram, and that's based on ideal body weight. You should expect 6 infusions overall for depression, as an example, generally 3 per week, on a Monday, Wednesday, Friday format as an example. But it is best not to let more than 5 days go between infusions. And we generally escalate the dosing each time slowly based on patient tolerability up to about 1 milligram per kilogram. Sometimes we'll find the sweet spot where the person's comfortable and improving dramatically. So generally speaking, each experience of ketamine is unique and noetic. There are not words that can describe the person's experience. Most of the time, the infusion is exciting, pleasant, and generally speaking, whether you have a great infusion experience or anxiety, you will find that the results are the same in terms of the antidepressant effect, whether the infusion is enjoyable or not. Now, most people, as the infusion has started, notice heaviness and numbness and difficulty speaking initially. There can be changes in light perception, sounds, and even visual distortions during the initial infusion experience. But again, you're always in control because when you stop the infusion, these symptoms go away within a few moments. At higher doses, individuals may note synesthesia, where you can maybe feel colors and taste sounds. And likewise, when the infusion stops, recovery time is within 10 to 15 minutes. You're awake during the whole process anyway, but generally speaking, individuals are up and about within the 10 to 15 minutes after an infusion. And a typical room at our office looks something like this, where you have a comfortable recliner and you also have aromatherapy with sound systems and all the comforts that are required. So the key points about ketamine infusions: expect 6 infusions over 2 weeks. You can do 2 or 3 infusions per week, but generally not back to back. In other words, not Monday and Tuesday in a row, but rather you want to skip days. And you will be functional the day after an infusion, so you could still go to work and you could still do things the following day, although some people do note fatigue. The doses are based on your ideal body weight over 40 minutes, generally starting at the lowest dose. And again, you don't have to have a trippy or dissociative experience to make this treatment work. It's really just about the milligrams per kilogram. And we'll discuss the trippy part in a later tutorial, later video. But also, after you're done with your series, you probably will need some booster doses in several weeks, usually 3 to 4 weeks. 70% of patients who are treatment resistant will have significant response or some remission, and the effects can last a week or several weeks. Each person is different, but just recall that depression is neurodegenerative. This is not a cure, but the goal is to put the person in a remission so that they have lengthy periods of time where they need less medications or less interventions, or they just functionally feel better. And these are all things that are addressed and followed and monitored with traditional medical scoring systems. As far as when you'll start to feel better, most people, it's by the 4th infusion, but results vary. And again, some individuals start to feel lighter and even better after the 1st or 2nd infusion. But for some people, it's not until the 5th or 6th infusion that they really notice the results starting to kick in. And for those people, it may require a few extra infusions. So for follow-up, we do offer home-based intranasal and oral racemic ketamine mixtures used in a prescriptive manner. And generally, these are microdosing. They are designed to give no sensory or psychedelic effect. They're just designed to maintain neuroplasticity in between booster infusions. And these can be very helpful. They are used in a prescriptive manner. So we do know that serial ketamine infusions basically affect key indicators not affected by traditional medications. We discussed that earlier. So with ketamine, we can expect increased energy and happiness and calmness and less fatigue and less negative self-talk. But again, everybody is different in terms of what parameters are affected or impacted or improved. And so again, this is a case-by-case type of situation where, again, you cannot really tell ahead of time who is going to absolutely improve and who is not, and what parameters are going to improve in their life. Just to let generally people know, insurance does not cover IV ketamine therapies for depression in general. You would need to continue your regular psychotherapy, but ketamine does allow you to improve your psychotherapy outcomes, especially where you're just kind of fixed in terms of what you're accomplishing in your therapy. Ketamine does allow you to consider new options and also consider new opportunities in your life. Ketamine is integrated into lifestyle changes. It does require you to work on your diet and exercise, socialization, fasting, supplements, and a number of other factors, including structured lifestyle and coping and dealing with substance use disorders. Ketamine is a treatment, not a cure, but it can make your traditional medications work better, and it can make you feel more functional and more effective and more hopeful. And the last thing is you should expect periodic booster infusions, usually monthly for a short period of time, but every individual is different. Some require more frequent infusions and some require less, and there's no way to tell ahead of time, who is going to have more effect or less effect. But with the way that ketamine infusions seem to work, we know that a significant number of individuals have response or remission, whereas they had no success or poor success in prior treatments.